My name is Abby James, and in this video I'm going to be demonstrating how to position and prepare a patient for surgery. This is Sugar, and she is here for just a routine stay. So we're going to go ahead and position her for that. This is kind of like a treatment table area, and after she's prepped and ready, she will be transferred over into surgery. Go ahead and put that. And our towel is clean, it just has staining on it. I'm going to go ahead and get her back on the monitor. She's right on her little arms. Okay, and I'm just going to go ahead and check her bladder.
Okay. I'm trying myself away from your usually. I have to get you.
Okay, so now I'm just gonna remove some of this hair.
Hello, kids.
Okay, I'm just gonna do one roll over just to make sure that there is no more loose hair. I didn't shave any of the hairs over here on the side because she's not really a long-haired kitty, and the hair wouldn't necessarily lay down on the cervical side. Okay, so our incision site is going to be at the midline here. Just gonna go ahead and start there. Okay, and I'm gonna go ahead and do this 3 times for each sleeve.
We could do your little nailies while you're here. Did you have to come? Oh, you're getting ready. I know. That was my teeth.
Her and Smithy were outside rolling around in the grass.
Oh,
They were
And I'm just gonna use this one to kind of lay down her hair a little bit.
love bugs.
Take your honeymoon time off?
Well, my parents are leaving tomorrow, so I just said, they won't let us cancel the vacation. So I just said, we're not there. And then when they came down, I took a week off.
Oh, that sounds good.
And you know what, you cash them out? That's the thing, right?
I'm just gonna lay this gauze soaked with the Chlorhex onto her stomach, and now I'm gonna let that sit for about 5 minutes before we move her into surgery. Now in this part, I've already turned our gas off and disconnected her. I'm gonna go ahead and move her into the surgery room. I'm gonna make like a little kitty burrito here and scoop her up underneath. Okay, and again, I'm going to be very careful not to touch anything on her belly or let anything else come in contact with it. Upside down. A little towel. Connected her back with her ISO. And I'm going to go ahead and tilt her down so it makes it a little bit easier for her to breathe. Okay, and I'm going to run back and grab a few prep things and just scrub it with one last scrub, and then we should be ready for surgery. Okay, I have my last round of these scrubs, so I'm just going to remove that. I'm going to make sure that none of this touches the surgical table or her. So I'm just going to pull that down. I'm going to start on her midline there and go around again. And after each scrub, I forgot to mention, I will like do a little check and just make sure that there's no hair or no dirt or anything like that sticking to the gauze, so I can be sure that she's clean. And I'm just going to lay this over her belly, and when the doctor is ready to begin her surgery, she can remove that, and that gives it a little bit more contact.